Welcome to Glow for Hope, sparking conversation on mental health, where we break the silence, build community, and ignite hope. We're here to talk about what really matters: mental health, wellness, and the conversations that help us all feel seen and supported. Every episode will bring real stories, expert insights, and practical tools to help you navigate mental wellness and suicide prevention. Because together, we can change the conversation. Let's get started. Welcome back to the Glow for Hope podcast, sparking conversation on mental health, where we're having real conversations about mental health and suicide prevention, because when we start talking, we start changing lives. Today's episode is one of that may completely shift how you think about mental health, especially in the workplace. We're joined by Dr. Colleen Saringer, a self-described blue-collar woman wrapped in a PhD. I love that. She's on a mission to stop work from hurting people. With over 25 years as a global organization health leader, combined with lived experience inside family-owned construction businesses, including one that nearly ended in suicide, Dr. Colleen brings a perspective that most people simply don't have. She's not talking about mental health. She's talking about the environments we spend most of our lives in and how these environments may be quietly contributing to anxiety, depression, and even suicide. This conversation is eye-opening, practical, and one that every leader, employer, parent, and employee needs to hear. Dr. Colleen, we're so glad you're here.
I'm so happy to be here. And it's so funny because every time I listen to a podcast and I hear someone say, "Oh, I'm so happy to be here," I'm like, that's so cliche. But I really am like so happy to be here.
Well, we're glad. We're happy to have you here. And I've just dubbed you Dr. Colleen instead of Dr. Saringer.
No, I love Dr. Colleen. And we can just go by Colleen as well.
Okay. Uh, so let's just jump in. You talk about a number, 267, and not the six
Right,
seven
not the
that's
six.
so popular. Yeah, that's a number that most people never heard before. Can you explain what that number represents and why it matters?
Yeah, I love that you said the 6-7. That is so funny. So yeah, so so there is a number that basically, unfortunately, the last time we have this number has that's it's been reported was 2023, or sorry, 2022. Anyways, all that to say, the number represents the number of individuals that have died by way of quote unquote work related suicides. And I'm using air quotes because this number is very vague.
Mm-hmm.
Some, not all, but some hear this number and say, "Oh, that's not too bad. We must not be, that's pretty low. Like we must not be doing too bad when it comes to suicide." And we also hear, "Well, how the heck work doesn't cause suicide to happen. It's totally an individual problem." And for me, all of that I like to call BS on it, because we spend the majority of our waking hours in the workplace.
Mm-hmm.
Um, for myself personally, I started working at age 13, so I've spent a lot of time in the workplace, as do many people. It is a huge part of what shapes who we are. A huge part of, right, what is shaping our mental health on a day-to-day basis. So that number is really important to me, that is being talked about, because I believe it's extremely underrepresented. Back to kind of where I was going in the beginning, is in the US, we have a really muddy way of tracking it. Companies, we don't really have this like checklist that says, "Oh, you did X amount of high job demand, or there was no support for your people, and so this is what led them to take their lives." So there's really like no way for us to truly point to the why behind that number,
Mm-hmm.
or even just question it, because especially in the US, we don't want to take blame, right?
Uh,
There are lawsuits, and it's extremely muddy. But we'll probably get into some kind of personal background. I do know that our work can impact us, and that it can be the icing on the cake that takes someone to
yeah.
do unimaginable.
For sure, for sure. And that I mean, that really kind of shifts the perspective, because we tend to separate work and mental health. And when in reality, as you said, they're very deeply connected. I mean, just stress alone, and
Yeah.
stress that you carry back home with you.
Yes. 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 There is no there's no separation, right? We talk so much about, oh, work-life balance and bring yourself to work. Well, guess what? Yourself comes home too. Just like you said, I'm hanging up my work self as soon as I get home, just like I'm not hanging up my home self as soon as I walk into the workplace. So I
Yeah,
just but this pendulum is always swinging when the reality is that it just is. Like we are our whole selves all the time, no matter where we show up.
yeah. We hear a lot about mental health awareness, self-care, resilience, but you say there's something missing. What you call the third leg of the stool. What
Yeah.
is that?
Yeah, so these are these work-related risk factors. Now, the professional term for them is psychosocial risk factors, work-related psychosocial risk factors, and I'll name a few. But I like to just say related risk factors because I just think it's easier and, you just
Hmm.
I don't want people to feel silly. Like, what does that mean? And then don't ask the question. So there's a variety of them. They include things like high job demand. So that means working more than 50 plus hours a week over an extended amount of time.
Hmm.
Low job demand, low job control, poor support, low role clarity, or organizational change management. There's actually 14 of them. I can even share like a link in maybe your show notes or whatever if you'd like so
Sure.
people can link out to it. Things like lack of reward and recognition,
It's
in other
big.
words, right, that's big, and that I appreciate companies wanting to pull in, like, recognition tools. That's not the recognition that we're talking about. We're talking about things like, "Thank you for working 50 hours this week. Thank you
Hmm.
for putting in a really hard day. The weather sucked, and I appreciate you showing up." That's the reward and recognition that the research is talking about. So when we talk about this third leg of this stool, at the end of the day, yeah, it has this fancy term, psychosocial risk factors, which are ultimately work risk factors. It's our work, it's the work we're doing and our work environment. So that's really what it is. That's the third leg of the stool. Those other things matter, mental health awareness, um, the resources that many companies are giving in regards to therapy, things along those things are really important. But if we're not changing the environments that people are walking into, then to me, it's kind of a waste.
Yeah, it's a very good point. Why do you think that the organizations tend to overlook these things? And what's the risk of focusing only on the individual?
Yeah, I think it's a couple things. I think one, we hear the word suicide risk and we think legally, what is am I going to be responsible? Could I be sued? Could I be blah blah blah? So I think there's a lot of that. Um I think it's also like I don't know what to do. I don't know how to do it. And so and when I say I don't know how to do it, in other words, let's just go back to that one about high job demand, a 50 plus hour work week. I don't know how, as a business owner or leader, I don't know how to change that because the work has to get done. So
Mhm.
we're just going to avoid it and say, this is just the way our workplace is. This is what you're signing up for. So I think some of it is just the unknown, the fear of what is that going to do to me as a business owner, as a leader. But then also, I think sometimes it's like, I just don't know what to do. And it's going to take too much time to figure it out.
So you're saying that part from the perspective of the employer that they don't.
Correct. Yep.
Okay.
Yep. Is that how you were asking the question?
Yeah, and from the organizations, but I was just trying to get clarity because it's like, yeah, I mean, they have EAP programs. A lot more companies are giving mental health days now than they used
Mhm,
to. So, I mean, those seem to be steps for improvement.
mhm,
And even, I guess, insurance is covering more of mental health resources. And
mhm.
so, are you saying that that's not enough or it just hasn't gone deep enough yet?
I think it's both. I think it's a yes and. I think it's yes, that's not enough and it hasn't gone deep enough.
Mm-hmm.
Because if we have this environment that is set up for, and there's other things on this list, things that we take for granted, like incivility in the workplace, um, ostracism, behaviors of those around us that we're like, oh, that's just the way Bob is. You'll get used to it.
Mm-hmm.
We we don't want to address those. We'd rather give resources to help someone deal with that rather than taking care of the that.
So rather than getting Bob to adjust his behaviors, it's the onus is put on
The
the
person
employee being
to deal with Bob.
affected.
Yeah.
Yeah, yeah,
Yeah.
that
Or
that
just
makes
get rid of
sense.
Bob. Yeah. But,
But
often
you can't
which is,
do that because you're going to have,
yep.
I was let go, wrongfully fired or dismissed or whatever that term is.
Yeah.
And yeah, and and there's so many factors when you consider how many different types of organ, how many different industries there are, and all the different things that people face every day, and like
Mhm.
the service industry and dealing with the public, which is even more. I mean, you can't fire a customer, tell them not to come
Mhm.
in because they're a jerk every time they they come
Mhm.
around, even as much as you would like to. Like, but so I mean that really reframes what's wrong with the person to what's happening around the person, like you said.
Can I jump in? I love what you just said about like the service industry
Hmm.
or retail. So it's interesting. So you may have. I'm sometimes a little bit behind on books that I read or get my hands on. So I do like to listen to some of these books that I call like nerdy, researchy books or like autobiographies. So there's a book out there called Unreasonable Hospitality. And long story short, it's a gentleman who took a restaurant to literally the number one restaurant in the world. Him and this chef.
Hmm.
And so it's hospitality, right? So you're in an industry, extremely high turnover,
Yeah.
right? High job demand. It's kind of cutthroat, right?
Mhm.
And the way that the model of this business, this restaurant, and basically ultimately they worked for this guy Danny Meyer who owns Shake Shacks and a couple of other restaurants. Long story
Love Shake
short,
Shack.
right? Who doesn't? The whole preface of the philosophy of the way that they created a great work environment and reduce turnover and burnout and all these things is they always put their people first, then the customer, and then the shareholder.
Hmm.
And
What a
so,
concept, huh?
right, it sounds like, oh, so it's like these are and so to me, we're shying away from talking about suicide prevention from the third leg of the stool because we're like, oh, we can't do this. But if you put your people first and allow them a voice, because ultimately what this whole book is about the people that are working for you feeling seen, valued, and like they matter. And those are
Mhm.
three key things that are going to prevent someone from ever getting to that point, right?
Yeah.
Of doing the unimaginable. Those are the reasons someone goes down that path because for an extended period of time they don't feel seen, valued, or like they matter. So that was the whole point of this book at the end of the day. And so
Interesting.
to me, you're not going to change the restaurant industry. How are you going to change that? But you change how you show up for your people. And that's how we do this. It's like we can't change construction. We can't change the way we're putting roofs down. We can't change some of these crazy hard industries.
Hmm.
We can certainly change the way we show up for them and
Yeah,
put
and
less
it's a ripple
attention.
effect,
Yes,
for
yes,
sure. And when people feel that way and feel good about it, they're going to treat the customers better. The customers are going to
exactly.
complain less, and
Exactly.
it all works great. Why is,
Yeah.
it's not rocket science. Why aren't we doing this?
Yeah, yeah, exactly. And so again, like those risk factors, yeah, they seem really scary and there's a lot of them. But if we're always putting our people first, then it becomes a little bit easier to manage some stuff that we just can't change, but we can still change Bob.
Uh, you talk about psychosocial risk factors and that there are more than most people realize, as we've been
Yeah,
talking. Can you, well, I guess you kind of broke down already. Are
yeah,
there other ones that you want to kind of break down in a way that so people can understand them? What are more common ones that you see
yeah.
and how they're showing up in the workplace? the way
Yeah.
people think.
Yeah, I think some of the other ones, the couple of the other examples that I gave, like the low reward and recognition, I mean, those things like saying, thank you for a hard day. This, the weather sucked. That's reward and recognition. So I always think that's an important one to clarify. Um, the other one that I want to clarify, so low job demand, this one I think is really interesting because when I left my corporate gig in 2023, I would say that I didn't leave because the job demand was high, because I had all this so much work. I left because my brain wasn't I was burned out from not using my brain. So
Hmm.
my brain cells were dying. And so that's what to me, low job demand always deserves a spotlight. So if someone is sitting in that, what's the point? I'm How do I demonstrate value? How do I do something more that makes me feel good?
Hmm.
That's that's a that can take someone to a dangerous path, right? And so we may not be able to get rid of low job demand, but we can certainly deliver the expectations when we bring someone new in and say, this is where the job's going to cap out. So I respect if after X amount of years you're done. This is all I have, right? So I
Hmm.
think that's also a really interesting one to talk about, like because low job demand, there's a lot of us that feel like we're just losing brain cells, and that's not good.
I can actually relate to that, and I never really would have
Yeah,
put it in that perspective because I was also working the 50, 60 hours a week
yeah.
at the same time that they wouldn't promote me to do a job I was well qualified for, and I was
Yeah.
basically doing anyway. But if they put me in the other position, and then this was back in my corporate days, 25 plus years ago, that if they put me in the other position, it left a hole where I was.
Yeah. Yep. So they didn't want to. Yep.
Nope, but and little did they know that at the time that I proposed a little different work arrangement, that I had already started my company part time, and so I gave my notice. I'm like, okay, I
Yep.
can go do this at home, and I can do it for other people, and not necessarily you. And then I signed him as a client for the next year and a half. The day I left.
That's so funny.
So,
Good for you.
but at the time,
Yeah.
it was like I'm just there's only so much I can do in this position. I loved what I did because I always just love whatever work I'm doing for the most part.
Yeah.
But I wanted to grow, and they were stifling my growth. And so it just, I mean, ultimately it worked out in the end, as it normally does
Yeah.
when you leave an employer that's like that, like it has for you too.
Yeah. Yeah.
But it's hard in the process.
It is. And I'm thankful that you shared that experience, because I think that that's where many of us find ourselves sitting in that chair of, I want more, I know I have more. And yes, money matters. Let's call it what it is. We need it for
Hmm.
basic needs, but that's only going to keep someone in a seat for so long. And then you
Right.
get into the quiet quitting and just all that stuff. So
Yeah, your
that
brain has
matters.
checked out, and
That your brain has checked out. And so
hmm
allowing someone to sit in that space for a long time can be a dangerous place.
yeah, yeah.
Yeah.
Bringing back all my corporate memories here.
How enjoyable and fun.
Yes or no? But it also, I mean, I can relate to the job I had prior to that was also, it was so stressful that,
Mhm.
come Friday at 4:01, when I got off at 4 o'clock, I was sick all weekend from the stress that
Mhm.
had built up and I didn't release. And then I was fine again on Monday morning. I finally changed that job,
Yeah.
and I was a much healthier person. But
Yeah.
I mean, that was more on the physical side, and at the time I wasn't as in tune as I may be now with the mental health aspects of
Yeah.
it. But it's, you have to, like you said, the money, you have to have it, the
Yeah.
benefits you have
Yeah.
to have. I think that, and I would appreciate your opinion on this. COVID changed a lot of that thinking.
Mhm.
You think?
Yeah, I think it did. I think it put a big spotlight on, because so many of us were removed from having to be in our offices.
Hmm.
or on the road or wherever we were. I mean, I know that many industries, things didn't change, like construction was still working and things like that. But for those of us that, let's just say, went somewhere or traveled somewhere, we were now removed from that negativity that was around us and thought, wow, I feel better. I don't want to go back to that. And
Hmm.
so that was eye opening, I think, for many of us during COVID, that piece. But then also I'm super thankful. I know COVID was bad, but I'm thankful there were some positives that came out of it. And it was the mental health spotlight. I mean, it's always been there, but it definitely put a huge spotlight on
Hmm.
the mental health crisis that we've been in.
I think it also gave the employers the perspective, or not perspective, but they could see that, okay, you can be a little looser in certain areas and business isn't going to go away.
Yep.
The employees, you had to show that they were valued if you wanted them to come in and do any little amount of work.
Yep.
But I think it was an employer shift too. And, like there's a lot more places, restaurant wise and stuff, at least in our local area, they're like, okay, you know what? If we close for the weekend because we need to give all of our employees a break, and it's something happening at town, or whatever, it's a holiday,
Yep.
they're not as worried about it for the
Yes.
most part. For the most
Yeah.
part, there's still some that are like, oh, I don't know, come hell or
Yeah.
high water, you better be here, and I don't care how many inches of snow are on the ground, you better be here.
Right.
And even though nobody's going to show up because they
Right.
can't
Right.
drive there.
It's a loss, right? Yeah.
Right, but I, I
Yeah.
I just think that their perspective has changed on that to certain degrees, and that
Yeah.
may be just more of, because I live in a smaller town. It's a lot more mom and pop kind of ownership, but I think that was another positive that came out of it too.
Yeah, I totally agree. I totally agree. I think it really just did I think it did a really long overdue um kind of recalibration of where we can't we can't keep this up. It's not good
Hmm.
for anybody. So yeah, I totally agree. I mean, again, I know there were a lot of negatives. I don't want to dismiss that, but I think a lot of good came out of it too.
Yep, yep. I agree. Yeah, I mean, suicide starts with feelings, and that's one of the most powerful things that you said, that it doesn't start with a decision, it starts with feelings. Can you talk more about that, and what are some of those early feelings people might not recognize, and particularly in the workplace environment?
Yeah. So, and I mean, you even summarized some of them yourself as we were just having this conversation. So, that feeling of overwhelm, right? How you said that on a Friday night in one of the jobs you had, you would go home feeling so stressed out, so overwhelmed. Yes, you were sick, right? But also you were extremely overwhelmed and all that. So that's one. The hopelessness, feeling trapped, we talked about that as well when we talked about the flip of that with the
Hmm.
low job demand, feeling like, okay, I need to pay my bills, so I have to keep this gig, but I feel absolutely terrible. Um, the hopelessness one, I haven't shared this story yet, but so the other reason that I'm so committed to this is um, so my parents owned a construction business in Cleveland, Ohio, and they opened that business when I was 5. And when I was 13, that's when I found out that my dad, he wanted to take his life after work, but instead he drove himself to the hospital.
Hmm.
Now, he was a business owner, and yes, my mom was his business partner, but he also felt trapped and he also felt hopeless because he was, and these are his words, not mine, he was in over his head and didn't see a way out. So, what did that come
Hmm.
from? High job demand, which is one of those psychosocial risk factors, poor support, feeling isolated, even though he had my mom as his business partner, right? They still were running their own separate aspects of the business. He's a baby, he's still alive. He's a baby boomer, like all these things. So when you don't, so all that to say, it starts with feelings. And then I think I said this a little bit earlier, but what we know is that if these feelings are present over an extended period of time from those risk factors, that's what can then contribute to exacerbate and or lead to anxiety, depression, suicidal thoughts, and suicides. So That's how I would clarify that.
Okay.
Um,
So is
yeah.
that what you call the 11-year gap also, or is that something different?
So no, the 11-year gap is something different. So
Okay.
basically there's I always love to bring in some of that nerdy research because I think it's really important. And this is also I think is really important for organizations to remember. And actually I appreciate how you were tying that together. So I'll make that a yes and. So the 11-year, because yeah, actually ultimately you just gave me another way to say that. So what we know is that from the time an individual starts to experience these feelings, like, gosh, something just feels off. I'm not myself in the morning. I'm starting to feel sick on Friday or Sunday or whatever. But maybe they just literally don't know that it's anxiety or that it's depression. That from the time a person begins to experience these signs or symptoms to the time they seek help, if they seek help, because remember, many people are not going to seek help.
Hmm.
The average delay is
Sadly.
11 years. Yeah,
Wow.
sadly. And so for my dad's case, he was for over 2 years in that, oh my gosh, I am in over my head, right? I'm trapped. I feel overwhelmed and hopeless and all that good stuff. So, but the average is 11 years. So I even have my own story. And I'll tell you right now, I probably, in hindsight, I think that when I was in my early 20s, that's when I started to feel, oh my gosh, I have anxiety and why am I depressed? And I didn't seek help until my 30s.
Mm.
So that delay matters. That delay is really important because these individuals, myself, other people, we're showing up at work. And then you overlay overwhelmed, or sorry, high job demand. I'm working with someone that treats me poorly. I'm feeling ostracized. I'm out in the heat. Environmental factors play a role in heightened
And then you
suicide.
start going to
So
more happy hours with your workers, and then that starts a drinking
exactly.
problem. And
Then you start drinking and that makes me feel better. So that 11-year gap is really important.
hmm,
Really important.
it's hard to imagine why people will wait so long. But then when you think back to your own experiences, it's like, okay, yeah, I could see that. And especially,
Yeah,
from like I said, I've been in business for 26 years, and it's and it hasn't all been unicorns and rainbows. It's
right.
there's a lot to it, and good for your dad for driving himself to the hospital instead
Yeah,
of over a cliff.
right.
And
Right.
it's there's a lot of excuse me, there's a lot of ups and downs.
Yeah.
And yeah,
Yeah.
I remember when I started out as home based, and then I'm like, the environment at home with two young kids and my husband and only a split level house, there was no way to shut off like
Yep.
the office and work from home life. And so I opted to get an office outside of my house, which I still have today, a different one. But um, the week I moved into my new office, I lost all of my clients.
Wow.
And that was pretty wild. It was like, oh
Yes.
my gosh, what am I gonna do? And
Yes. I
you
just
know,
signed
and
this lease and blah, blah, blah.
mhm,
Yes.
yeah, I mean, there are scary times, and so it carries over. I mean, work is work, whether you're working for yourself or working for someone else. I think in some cases there's different pressures or more pressures from the entrepreneurial side or small business owner. Um, but and even taking that first leap of faith to leave the full-time job and
Yep.
go out on your own. And
Yep.
and then your coworkers are replaced by the clients,
Yep. Right.
except
Right.
those
Right.
clients really are signing your paycheck. When you Other than
Right.
when you threaten Bob, say, hey, you know what, I don't care, you're not signing my
Right.
paycheck. Well, these guys are.
Right.
So
Exactly.
it,
I actually I appreciate you bringing up I appreciate you bringing up the how like, works when how much work was spilling over, right, into your life while you were building your business and you were doing
mhm.
it out of your home. My husband and I've pulled him into the public speaking stuff that I've been doing because he's a business owner now. Or he's been a business owner for 17 years. but I wanted to make sure that he was protected. Like, in other words, I didn't want to ever see him get to that point that my dad did.
Mhm.
And so we talk so much about it. What you said is exactly it. As you were summarizing that, it doesn't matter if you're a business owner or if you're an employee of someone else. So now pull in our conversation we just had at COVID, because that was one of the negatives.
Mhm.
There was no separation. People were working longer, more, right? So I
Yep.
appreciate you saying that, because it's business owner, non-business owner, work is a part of us no matter where we are. No matter what our title is, what our role is, how long we've been in it, it is constantly there, constantly.
Yep. So then it's just, how do we deal with it and deal with it the right way in the most positive
Mhm,
way possible? So it's you use a powerful analogy about handing someone a bucket for a leaky roof instead of fixing the roof. So I think that kind of falls right into what, kind of summing up what we were just talking about. And okay, how do we get into the fixes?
mhm.
So
Yes.
can you explain what that looks like in
Mhm.
the workplace mental health?
Yeah, yeah. So I'm a big believer of, and that also kind of ties to what we've already been talking about, right? Like handing them the EAP, but not changing the environment.
Hmm.
So, and I get pushback on this all the time, but I know this works because I watched my parents build a business around this. I watched my husband build a business around this, and that book that I was referring to. These things are not rocket science.
Hmm.
So, one of the things that I do believe in very strongly, that again, let's go to an environment that we were like, well, I can't change the job demand. I can't, I mean, sure, I can hire more people potentially if I have budget, but I still can't change how hard the work is. So I'm going to
Yep.
start to sound like a broken record here,
Oh,
but
you're good.
I believe that the way we show up, and I use the word kindness a lot, and people get very like, oh, what? So just because I'm nice? No, that's not kindness. Kindness is showing up in the morning and saying to your employees, good morning. How are you today? What's on your mind? What do we need to be worried about on the job? So we need to start to build this environment. You can use psychological safety, you can use whatever fancy word you want it, that the world is throwing out there today. It's literally just like basic human decency at the end of
Hmm.
the day. And letting your employees actually be okay to give you the feedback back without feeling like their job is on the line.
That's such a key spot right there.
Yes. Yes. And so when I think about my husband, he could never offer benefits. He's a small business. He would not still be in business. I mean, he's always been 10 employees or under. You don't get health insurance and offer
Hmm.
that, right? But you can pay more, you can do those things, but
Can't
you
even do
can,
it for one.
exactly. Right, exactly. But what you can do is you can treat your people well. You can, again, how are you? Good morning. Be safe, because then that creates that in space where someone's going to actually come back and say, "Hey man, like this was bad. Okay, well, what do we need to do? You're the one that's out there. You tell me. Doesn't mean I'm going to use it, but you tell me." So you bring them in to be part of the solution.
Hmm.
So we're not bringing our people in enough to be part of the solution. They're the ones out doing the damn work, but we're with our
Right. People want to be a part of something bigger and what
yes,
they grow.
yes. So I talk a lot about kindness and showing up, and I get so much pushback on it, like, but once what's the intervention? And when people are saying intervention, it's but like what's the program? What's the, like, it's making sure that we all do understand how to show up, because we take for granted that people learned that. And we
Yep.
can't. Maybe they didn't come from an environment where saying good morning was even safe.
Yep. Yeah,
And so
that's sadly that's very true.
yeah. And so it to
It's
me,
it's just the golden rule.
yes, like let's just get back to the basics while
Hmm.
we're trying to scan for how do we change the job demand by hiring more people or shifting the work or firing customers, I don't know, or how do we, deal with the incivility, the bullying. Let's at least start by some ground rules of how we're going to show up for each other.
Yeah. Yep. I like that. It's it does just sum it up into one simple word or a statement as far as just being human.
Hmm.
But there's muddy waters on being human anymore, and that's
Yes.
scary. So
Yes.
scary.
It's so scary. I mean, my husband and I, we joke, we don't have children, so I always refer to him. I mean, I do talk to the dog, but
They count.
they count. But I'm like, gosh, are we turning into like our parents where we're like, it's scary, like just this general stuff is decency. I'm like, no, I think it actually is a problem. And
Um,
other people are feeling it too. So that makes me feel like I'm not turning into the old lady that's gonna yell at people to get off my lawn.
no, you're not. But it's all, it's that ripple effect or trickle down, whatever you want to call it. It's still, it's like, you've got babies raising babies right now,
Yes,
and
yeah,
they don't know how to deal with their own mental health in their life and emotions. And it just, it even, when you switch that to the customer service aspect, it's like they didn't grow up like I did
right.
or you did, knowing how to properly treat a customer or people or your siblings. And so it, and I shouldn't generalize that across the board. It
Sure,
does
I
still,
understand.
the environment at home, and
Yeah,
a lot of kids that just can't even, first off, they don't have a home to go to, or the environment at home is so tough that it's better on the
yeah,
streets, which is
yeah,
again so sad.
yes,
But we just, we have to do better, people. We just have to be a better
yeah.
world
We just have to be
in
better.
general. Yeah.
Yeah, yeah.
Yeah.
And sorry, I was just gonna say
No,
that
that's
might, I know from I'm looking at some of the other talking points here, that actually might be an interesting or a good segue into like, because I was talking a little bit about acknowledgement. There's actually research around this that they're called these micro moments, these moments of interruption.
hmm
And so when we do say good morning to someone or hello or how are you, make contact, even remove it from the workplace, just do it to the stranger on the street.
yeah.
That that one moment, and there's survived people that were like, I was going to jump up. I mean, there's a individual that was like, I was about to go and jump off the bridge, and I said, if somebody sees me, I'm not going to do it. There's stories of people that has saved their life.
Yes.
But then we're
Yes.
working in this weird kind of push pull of, but we're taught not to talk to strangers, and so it's just this whole mess, right? But I'm like, just at least say good morning.
I do. I
Me
do.
too.
My most of my family, I should say my kids and my husband, they're not morning people. Morning people, it's like, don't talk to me before I've had my coffee. Well, I don't drink coffee. It's
Yeah,
like I could,
same.
if I got a good night's sleep, I'm waking up in a good mood. I want to say good morning. And
Same.
even in a text message, good morning. Somebody needs to know that they've been thought of, and just feel appreciated, just like you would, even if
Yes.
it's before 10 a.m.
Yes,
or your
because
first
that
cup of
says I
coffee.
see you. Yes, it
Right.
says I see you, you matter. Period.
Right. Let's talk about something that doesn't always get enough attention, and that is the employee voice. What happens when people feel like they don't have one? How does that impact their mental health over time? And does having a healthy voice culture, what does that look like? And I know we've touched on that some, but I think you can go
Yeah.
a little bit deeper into that
Yeah.
area.
Yeah. So one of the big, so yeah, to your point, we definitely touched on this a little bit, like, again, asking someone, what did it look like on the job today, blah, blah, blah. So I'm a big believer, and I feel like I don't want to say a lost art, some kind of a lost art, but I think also, again, COVID has shifted this based on the way, workplaces are changing, more remote and things like that. But I do believe that we have lost the critical component of working alongside our people.
Mm,
So rolling up our sleeves, getting into the day to day, and that even is like that even in my personal opinion, something like maybe now you're the CEO of company. But if you started as a receptionist, go do binders. Go make copies.
Mhm.
Go back and do the job because your lens is so different. And
Yeah.
that is how we start to build that trust. That's how we start to see, oh, wow, this is, I don't know how one person is doing this job. Or holy crap, they are in major danger. Not from like making photocopies, but from something else, right?
I don't know. That Xerox
I don't
machine is
know.
awful.
They are pretty
That
crazy,
could be
right?
very stressful.
They're always broken. Someone's always changing the toner.
Yeah.
But
I let, I'm sorry, go ahead.
no, 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 please, you go.
I was just going to say, I loved that show, Undercover Boss, because
Yes.
that's exactly what you're
Yes.
talking about.
Yes.
And
That is
it was so
exactly it.
eye-opening for so many CEOs. And I love that. I don't know why it's not even still on.
I know, but that's exactly it. I can remember when I came up in the whole organizational health industry, it was all about having conversations and doing quote unquote assessments, but those assessments meant being alongside your people. And
Mhm.
so, how, what a better way to start to again build trust than to see your boss doing the grind right next to you. And then
Yeah.
that starts to again create that, oh, well, now when they ask a question, like there's this moment right now when they ask this question, I feel okay. I feel again safe and trusted. All of those things start to elevate our minds differently.
Hmm.
And those can serve as protective factors over some of the things in the workplaces that we just can't change, or maybe we never want to change. But those little things can serve as a protective factor. So
Yeah.
again, it's like that employee voice is imperative, but if they're afraid to use it, then we have
Perfect.
people suffering in silence, and your
Yep.
awareness campaign is not going to help them.
Yep. The fear of repercussions
Yeah.
is real. The
Yeah.
struggle is real.
It's one of
Yeah.
my, and the reason
I have
I
an
come,
open door, but
yeah,
hey.
right. But is it safe for me to come in? So this
Yeah.
framework that I talk about a lot when I'm speaking on stages, it's this action framework, and a lot of it is stuff that I learned myself in working in the industry, but a lot of it is what I how I watched my dad be successful,
Hmm.
especially after that pivot, that moment of pivot, right? And you would never know who the business owner was at my parents' company because he would be loading the trucks. He would be eating lunch with his employees. But there were very specific rules around lunch. It was never talking about work. It was always
That's
talking
good.
about anything but, right? Because that's the last thing you want is to feel like, oh, great, now, but that's part of starting to build an environment where the voice matters.
Yeah. That's
Yeah.
great. So let's talk about the construction industry for a minute because it is one of those high risk industries for in so far as suicide rates, and I don't think a lot of people realize that.
Yeah.
It's getting a little bit more attention now
Yeah.
than it used to. But why is it such why why is it such a high risk industry? What are the biggest factors, and what needs to change in those environments to
Yeah.
reduce that?
So I'll pull in some research and then I'll pull in some research, of what we know. So it's an industry where again demand is high. The job demand, like we talked about, low. I mean, you're doing this same repetitive movement over and over and over and over.
Mm.
So physically, I mean, and mentally, right? Exhaustion. There's not a whole lot of so again, not a whole lot of opportunity to kind of go, yes, you could become a foreman, but often you kind of cap out depending on where in the construction industry you are. Um, Isolation and remote work. It's always interesting. And for me, I feel like I have to remind myself not everyone has a family member that's in construction, but construction workers go where the work is.
Hmm.
And so that's months on end away from their community. And if they don't have a community at their workplace, because I think we forget work is good for us. It can actually be a great thing for our health. But if they don't have a community with their people, then they're going to go to the bar after. They're going to, just continue to isolate themselves while they're already away from their communities, their family members.
Mm-hmm.
And then the environmental conditions. This is also an interesting one. In heat, we actually see suicides increase. And so there's these interesting factors in the construction industry that, in addition to the fact that yes, we all have mental health, those again, those psychosocial risks, those risk factors are overlaying, and we don't have someone checking in and asking, how are you? We're, saying work harder, get the job done faster. So we're not bidding projects that are taking into account it's hot. They need the opportunity to take more rest breaks, or let me bring them water and not expect them. Simple things,
Mm-hmm.
right?
Again, the human decency.
The human decency. And that's what's being talked about a lot. Um, there's a ton of work in the industry, of course, being done on um, substance abuse, because again, lots of drinking, right? Opioid use. What we know about
Mm-hmm.
construction workers, or even just the general blue collar, is that when they're injured and they're not working, that too increases your risk for suicidal thoughts and suicides. And so anyways, all that to say, there's a lot of work being done around those things, but where we need the work to start is how, I'm a broken record, how we're showing up for our people and
Yeah.
creating spaces that are safe, and creating spaces that can still feel macho, but just create the safe macho space. Like I always tell people, in the blue collar industries, swearing is like normal. And
Yeah.
everyone's like, "Oh, what are you gonna do? Tell us to stop swearing?" No, but like put some rules around how you're gonna talk to each other when you swear. There's a lot of industries that do that well. You're not allowed to cuss at me until you've greeted me, and then you can cuss at me, but you have to see me first.
I have never
So
heard that before.
yeah, so like
That's great, but I just
right?
never heard
I
that.
mean, you can't tell me to go get the effing hammer until you've said, "Good morning, Kelly. How are you? I know this is a tough day, whatever." Now you can tell me that, but if you haven't even acknowledged me, you can't. So there's unique things that we can do to start to create kind of rules of engagement around it. But if we're not telling what's expected, the trickle effect is not going to happen. The domino, right? So and there's just so much of construction we can't change. We can't change that the jobs are away from home. We can't change that it's hot out. We can't change that
Right.
it's hard work. We can change how we treat each other.
That we can do. And you didn't even touch on the fact that it's an industry that is predominantly male, and they're in the higher suicide risk
Yep,
lane to begin with, just
yep,
because of the macho thing, and not
yep,
wanting to talk and share feelings. And
yep.
so we've got to, let's put our PSA out there to, hey,
Yeah.
talk to your construction guy, your electrician. My dad was an electrician,
Oh,
and
yeah.
so I can understand, being away from, he had projects that took him away from the area at some
Yeah.
points in time. So, talk to him, give him a chance to share feelings and be there for him. And
Yeah.
it's not just asking the questions, it's being prepared to listen after the question is asked
Yep.
and given the time.
Yep. And exactly. No
Otherwise,
drive-by
it's hollow.
listening. Yes. Yes. Actual listening. No drive-bys and no like looking all around, like actually listening and having a conversation.
Mm-hmm. Mm-hmm. So important. For someone listening right now, whether they're a leader, a coworker, just someone trying to show up better. Actually, I'm going to back this up just a minute. You've used the term showing up and show up multiple times. What does that really mean to people say show up,
Show
be
up.
present?
Hmm.
What does that mean? How do
Yeah.
we do how do we do that?
Yeah. So we actually just touched on a couple of things. So definitely, um, I'm a big believer, and there's also research around it because I'm a nerd, a researcher. There's actually research around the good morning, the how are you, that again says that that's one way to show up. Um, the presence. And so I am a lot. It's interesting because a lot of individuals will, well, I don't want to say hello because or ask a question because I have so much more to do, and then that means I'm gonna be stuck in a conversation for 30 minutes and I need to get to my desk. Oh, okay. Unless you're finding the cure to cancer, it's not that important. Right. But I'm a big believer of letting someone know I only have 5 minutes. I'm going to set my, I'm actually going to set a timer so I can be present with you.
Mm.
And when that goes off, we can continue the conversation later. Or actually saying, I want to hear you. I can't right now. As soon as I put my stuff down, you have my commitment, I'll come back. So that to me is also showing up, is being present, being honest, not hurting someone's feelings. Well, I don't have time for this right now, right? But like actually, you matter. I will be back. Give me, if you could give me 10 minutes, you'll have my full attention. Um,
And
so
then make
those,
sure that you go back.
and make sure you go back. Yes. The other one for showing up is again, no drive-by hellos and no drive-by um uh listening to responses, again, actually being present. Saying thank you
Mhm.
at the end of the day. Like, I don't care how, like, just say thank you. Thank you for working today. I know that's your job, but that's part of the reward and recognition.
Yeah,
So that to me is showing up.
that's great. Thank you for taking the time to share that because I think it's one of those things that the it's almost like a buzzword. Excuse me, a buzzword that we
Mhm,
hear all the time. Oh, show up, be
mhm.
present, blah blah blah.
Yeah,
Well, okay, but am I doing that? What does it
right.
mean to do that? So thanks for taking the time to kind of
Yeah.
expand on that a little bit.
Because it really can be that simple. It really can.
Mm-hmm.
And
Mm-hmm.
that can go so far. It used to go so far for me. I mean,
Yeah.
so far after a, 17-hour day of traveling and the person that dragged you along says, "Thank you so much. I really appreciate it." That gave me everything I needed to come back the next day.
Yeah. Yeah. Everybody wants to feel appreciated.
Yes.
It's Is there anything else that you want to make sure that we haven't covered that you wanted to make sure to share with our listeners today or
The only thing that I would add, which I think I just said it, maybe I would just kind of add an exclamation point, is that it really doesn't have to be that hard. That we all have it in us. Maybe we just need to like reignite it. Maybe it's been sleepy for a while, or maybe we didn't learn it, and that's okay. So I think that to me is that we, some of these quote unquote simple, basic things actually are valuable and viable solutions that we can bring to our workplaces. So that's just what I want to like underscore, is it can be that simple.
great. And this might be out of your wheelhouse, but when you are the person that's trying to be that way and you constantly run into the others that are negative or don't want to play in the same way, do you just keep showing up and doing it every day till the point they get pissed off and say, leave me alone? Or what, I mean, how do you handle those that don't accept that same thing or they haven't learned it or they don't practice it that way? You know what I'm saying?
Yeah, I do believe you keep showing up. It doesn't have to be like, and I'm not using the word aggressive as in like mean. I'm using it as in it doesn't have to be overly, you don't have to overly exert it, but it's just that consistent, like, I'm going to win them over in the back of your
Mhm.
mind, right? That's what I always think about. Just that, good morning, how are you? Because over time, it does start to slowly peel away, peel away one little piece at a time, because who knows where that lack of trust or that lack, who knows where that is, but that starts to open the door just a tiny crack every time. So again, it doesn't have to be anything crazy, but I would encourage, and I do think there's value.
Mhm.
Keep showing up.
The
Keep
more that
showing
do
up.
it, the more that it spreads, just like that
Exactly.
kindness.
And you'd be shocked how many people will start to lower their
Yeah,
card. Yeah.
yeah, that's great. So where can people learn more about you? I know we'll put a link to your 14 risk factors
Yeah, I'll
in the
definitely
show
shoot that
notes, but
over. So that you have that for the research. It's also, I'll shoot you my website, colleensaringer.com. I have a link to that, but we'll pull that link out so that you can link to it separate.
Okay.
I'm also on LinkedIn, but that's where you can find me.
Great, great. This conversation really reinforces something we talk a lot about at Glow for Hope, and that mental health isn't just about what's happening inside of us. It's also about the environments we're in every single day. And our mission, as you know, is to spark conversations, create community, ignite hope. And this is exactly the kind of conversation that moves us forward. So thank you, Dr. Colleen.
Thank you.
Thank you for being here. Thank you for doing the work that you do. This is a conversation that needed to happen. And to everyone listening, if something in this episode resonated with you, don't keep it to yourself. Share it, start a conversation, check in on someone, because you never know what someone is carrying, and one conversation could make all the difference. We'll see you next time on Glow for Hope, sparking conversation on mental health. Thank you. Thank you for joining us on Glow for Hope. If today's conversation resonated with you, share it with someone who needs to hear it. Remember, your mental wellness matters, and you are never alone. For more resources and support, visit glowforhopenfp.org. That's glowforhopenfp.org. Stay connected, stay hopeful, and keep the conversation going. Until next time, keep shining.
This podcast does not and is not intended to provide medical advice. The information presented on this podcast should not be interpreted or construed in any way as a replacement or substitution for medical advice. It is important that you discuss your condition, treatment options, or any questions that you may have with your doctor or healthcare provider.